So it is 3 o'clock and we are live again for one more YouTube session. I hope everybody joins early. A lot of people are waiting. Yeah, so we'll start with a case and then maybe we'll take on some questions. Let us start with let us start with the case first. Now, there are a lot of cases. There are a lot of cases in today's practice. Of late, we are getting a lot of cases where there are a lot of pain in the body and fever and malaise and a lot of no desire to eat, just to lie down. And there are a lot of cases where we have found very, very good remedies which are very close together. Sometimes it works and sometimes does not work. Because most of the time we feel that this remedy is absolutely right, it should work, and suddenly it does not work. So we have a lot of Instagram friends, Dr. Palak, Dr. Vishal, Dr. Good afternoon. And that's why sometimes we feel that our knowledge of prescribing, whether it is sufficient or not. Let me tell you, whatever mater medica you know, whatever you have learned from your college, that is sufficient enough if you are able to interpret what the patient is trying to tell you. Now, Dr. Sharon, good afternoon. This is very important. Now, I had a case. If the doctor is there, she will share some case. It was an interesting case. We gave the remedy, and the patient came out within, I think, 4 to 5 hours of the fever. We treated the case. Now, in most of the cases, when there is fever, when there is body ache, when there is malaise, we normally have remedies like Eupatorium perfulitum, and it gives us very, very good result. Remember one thing, there are some symptoms of Eupatorium perf which are very, very important, and that has to be read it in detail. Just by prescribing only on a body ache or just by prescribing on the thirst, and sometimes we might get or we might not get results. It is very important to understand that Eupatorium perf suffers from bony pain. Now it is, welcome Dr. Angari on Instagram. Hello Dr. Babel, Dr. Sachdev, Dr. Meera, Dr. Smith, Dr. Vishaka. Bony pain, the patient may describe. I had a case where the his daughter had fever, and the daughter used to tell, just press my metatarsals. The daughter always told, just press my metatarsal, and she had body ache, but more body ache in relation to metatarsals. This is also related to bony pain. It is not always that the patient comes and tells you that there's bony pain all over the body, there's a lot of pain in the bones, and it is better by massage. No, those are classical symptoms you might or you might not get. It is also possible that the patient comes. I had a case where the patient comes and tells me, my wrist pains too much during fever and I have to always keep pressing my wrist. That is also Eupatorium perfulitum. So this is very important to understand that everything is painful in parts also. Sometimes only metatarsal, sometimes only metacarpals are painful, sometimes the wrist is painful. It is not necessary that the patient complains the whole body ache is there for Eupatorium perfulitum. And sometimes the patient only says there is so much pain in the eyes, even if I touch my eyes, it is so much pain, I feel as if the eyes will come out. That is also Eupatorium perforatum. It is not always belladonna or bryonia or glonine or natrum mur. Remember this, your knowledge of mater medica, I feel, is sufficient what you have learned from the college, but your application differs. And that's why sometimes the simple case of Eupatorium perfulitum, you may prescribe arsenic, sometimes China R, sometimes uric acid, and then you realize that only one drug is left for pain, and then you prescribe Eupatorium perfulitum. Please go home and read Eupatorium perfulitum. It can be localized pain in the bone also with fever. That is also Eupatorium perfulitum. I hope you understand this, because there are a lot of cases that go uncured because of our lack of clinical experience or clinical interpretation of a particular symptom. I hope everybody is understanding. Yeah, welcome Dr. Fatima, Dr. Okay, you understood that. Now it is written in Eupatorium perfulitum that chills is at 9 o'clock and XYZ. You may not get the modalities of time sometimes. So don't keep on pressing and asking the patient, when does the fever come? When does the fever come? It is 10 o'clock or 11 o'clock. If it tells you directly, it's well and good. If it does not, don't create symptoms out of nothing. Jupiter perforatum has given, I feel I have never failed in that case of Jupiter perforatum. Okay, so that is important, your interpretation of symptom. Of course, it is said that in Jupiter perforatum there is bruised feeling as if broken all over the body. You can compare that with arnica or Bellispur, but don't forget Jupiter perforatum. Okay, so this is, I just wanted to clarify Jupiter perforatum. So there's one question from Dr. Vishaka. In diabetic patient, burning of souls doesn't go through other symptoms of patients are better. Your experience, yeah. Now in chronic, I had a case of just about 15 days back. My 1 year junior was was being treated with diabetes with a doctor, a homeopath, well known, and her sugar post meal was 350 for the past 5 to 6 years. And when she came to me for treatment, her first symptom was, sir, please treat my tingling sensation, numbness sensation on my foot. I am taking vitamin B12, but still it is not working. Now, what happens in chronic diabetes, because of the peripheral neuropathy, there are some cutaneous circulation which are disturbed, or you can say those arteries basically are sclerosed. And basically, what happens, welcome Dr. Mushtaq, it's a permanent damage, and there is a sensation of pad like or not wearing slippers or neuropathy type. You cannot start just giving you what we call vitamin B12 and feel happy. In that case, a very, very simple remedy I prescribed the patient. First, I gave Ginkoba biloba 30 3 times a day for 3 days and told her to report me. And within I think 4th day, she told, sir, it is slightly better than it was 10 years back. Ginkoba biloba. And then I prescribed the constitutional remedy. The case is under my care. It's only about I think 10 days old. When the case starts getting better, I'll tell you the follow-up of the case. But in case of this neuropathy, it is very important. Normally, I get very good result, Dr. Vishaka, by ferrum phos LM potency. I get very good results with ferrum phos LM potency and lecithin in powder form, 3x or 6x. It does give good results, the local effect. And then the constitutional medicine, if it starts, when it starts working, it automatically takes care of the sugar and the neuropathy. This is my experience of treating this. See, Ginkoba biloba, basically, whatever experience I have of Ginkoba biloba, it's not basically, I prescribe it routinely, but whenever there is blood supply is compromised, the circulation is compromised, in aged also because of arteriosclerosis, in young because of secondary to some disease, metabolic disease like diabetes or blood pressure or thyroid problem, I normally prescribe Ginkoba biloba, and that's the only symptom I take for prescription, because constitutionally I have never prescribed Ginkoba biloba, only for acute complaints. Welcome, Dr. Sultan. So this is, yeah, Dr. Borkar, Dr. Disha, good afternoon. So this is my experience on my basically treatment of Ginkoba biloba. I use in those type of complaints only. Does Ginkoba work in souls? Yeah, Ginkoba basically, if you see, it works everywhere. The circulation is disturbed. Now see, if you go to, I know the mathematics of Ginkoba biloba also. Ginkoba biloba, basically, if you see, it's what you call, it is basically a plant having qualities to improve the circulation. For example, if you have read, I think it is written Julian Mathematica, it is said that it is indicated from the face. Face is very pale. There is generous lameness, heaviness of the frontal region. This is what I remember symptoms of Ginkoba biloba. But basically, I prescribe it for circulatory problems of secondary or primarily in old ages because of arteriosclerosis. सलाम सर, क्या कॉन्स्टिपेशन टीनिया क्रूरिस का वजह हो सकता है? हाय डॉक्टर संगमा. Yes, see, one thing is that direct relationship of tinea cruris I have not known, but constipation, whenever a person suffers from primary constipation, secondary means secondary to some disease is something different. But primarily, if you suffer from constipation, that means there are a lot of things, there are a lot of negative emotions in the patient's constitution which is not able to take out of the system, and that's why he suffers from constipation. That's what I have seen in my practice. Welcome on Instagram, Dr. Sneha. Dr. Parvez, I hope you understood that. Constipation, tinea cruris, I cannot comment because I have not come across these type of cases. So let us go further. Eupytorium perfoliatum, I hope you understand, and I hope you understand the difference of prescribing between Eupytorium perfoliatum and arsenic album. Whatever I have understood in arsenic album is very, very important. Dr. Shoaib Sheikh, welcome. Yeah. So whatever is understood in arsenic album, remember one thing. There is lot of anguish in arsenic patient. Lot of anguish and lot of anticipation. If you want to differ Eupytorium perfoliatum with arsenic album, it is a very, very important thing, and burning thirst, few mouthfuls, 2 or 3 sips and he's better. That's arsenic, especially great thirst for cold water. That's a difference you have to see. I have seen in cases of Eupytorium perfoliatum and arsenic album. Okay, let's see one case of Dr. Sangma. I'll help you if I can. So I have a colleague who listens more sentimental music or songs when she feels angry or sad against someone, and this brings her peace. See what Dr. Sangma, one thing understand. When you are very emotionally disturbed, you like the lyrics. When you're happy, you like the music. Remember that. It is such a mathematical calculation, when you're very upset. And if you ask me, just prescribing on listening to music would be, I think, wrong on your part. Because see, music basically is sometimes lot of people come and tell you that they feel better. But don't prescribe on that symptom, because see, if you in mathematics or repertory, if you go to see music ameliorates, and then you have barrage of remedies, you have aurum metallicum, you have tarantula, you have thuja, you have carcinosin, you have natramur or mercury, or lot of remedies. But my suggestion would be, ask her first that why does she get disturbed, from what does she get disturbed, whether it is humiliation, mortification, chagrin, abuse, dominance. There are a lot of things. And her reaction is basically music, because she does not have any friends to talk with, or she does not believe or trust in their friends. That's why music basically is only one way traffic. Just listen and feel happy. So only prescribing on music ameliorates, I would not prescribe if I had a case of this sentimental library. I would have gone to the cause of depression or cause of sensitiveness rather than only music. She likes being alone. So basically, that's how you have to enter the case. If the patient likes to become alone, then you match that with Sora. Whether in Sora also the patient did like to stay alone. At that time, maybe she had no friends or she was very sensitive. That's why people bullied her. And because of the sensitiveness, she feels that she's okay, because she cannot manage the other tantrums of her friends, family, relatives. So you can go there and see, and now you have 2-3 symptoms. Like desires to be alone first, and second symptom is this music ameliorates. In this way, basically, when you start asking symptom to the patient, automatically your remedy will come out. So just for repetization, don't take only the emotional symptom for prescription. Sometimes match that symptom with Sora, automatically you will get some results. Whether she was emotional, whether she desires to be alone. Persons who like company or persons who want to be alone, there's a lot of difference. Persons who want to be alone does not want to get hurt because of the sentimental or the sensitivity of the constitution. So we require a remedy which is a very, very sensitive personality, sensitive personality. And then if you go to the rubric sentimental, and then if you prescribe the remedies, I think that would give you better results rather than only prescribing for music ameliorates. Okay, then you have to see what is the sensitiveness. Sensitiveness is more marked in the morning, evening, night, or she is sensitive to a particular group of person whom she is not pally with, or she is sensitive to children's, or she is sensitive to external impressions, or she is very emotional sensitive, or she is sensitive to imaginary things, or she is sensitive to, there are a lot of things. Simple sensitiveness can be described in a lot of areas. So define that sensitiveness of the patient, and then get back to the remedy. And if you don't get, I'm always there on WhatsApp. Dr. Smiling Homeopathy, welcome. Dr. Sangma, Dr. Nikhil, welcome. I need your help. Please share alone. Offensive smell from all sorts of food after fever. Okay. See, offensiveness of smell. Matlab, what happens? The smell has become very acute. Now, when the smell has become very acute and the smell has become very offensive, that's a different thing. So when you see this case, see the remedies. Now I'll tell you. First of all, offensive smell, and secondly, acuteness of smell. She feels the smell very, very what you call more than normal. You think of 4 or 5 remedies which I have got very good results in my practice: phosphorus, sulfur, belladonna, calcarea, nux. These 5 remedies I have got very, very good results in cases where the smell is very acute and very offensive after fevers or after any disease. So welcome Dr. Pramod Ingle, Dr. Sangma, Dr. Minde. Please suggest something for numbness in arms, palms, especially on griping things. Numbness. See, whenever you complain, when the patient complains about numbness, it is not always that you give the remedy and the patient is better. You have to then see whether the patient's hemoglobin is normal or not. That is important, no? And if he is basically malnourished or there is malabsorption, you can have numbness in the palms and soles in that conditions also. Just prescribing for numbness, of course, there are remedies in homeopathy. Everywhere there's remedies in the repertory everywhere, but I would just ask you to take few more symptoms rather than prescribing on numbness of the palms or soles. But still, if you want, you can write down some remedies. Whenever the patient complains about numbness of the palms, first few remedies that come to my mind is, first is bryonia, okay. Second would be opium. Third is phosphorus, and fourth is conium. This is a remedies, and then you have to always think that numbness, why? And numbness of the sole again is a very, very important. I just told you in case of diabetes, this is a very common symptom because of what you call neuropathy. But if the patient says classical numbness of the sole, the remedy which comes to my mind, it is very, very important. I may have used this remedy maybe years back. That is cocculus, nux, and alumina. And if you that combine the numbness of palms and numbness of soles, and if you repertorize this, you will get only 3 remedies, Dr. Mende. One would be bryonia, second would be phosphorus, and third would be surprisingly, syphilinum. That is important. Welcome Dr. Tushreen on Insta. So I hope you got this. So if you repertorize both numbness of palms and numbness of sole, the remedies are bryonia, phosphorus, and syphilinum. I hope everybody is getting what the answers or understanding something what I want to convey, because this is very important. That's why I was pressing on arsenic album and Eupytorum perfolatum, because my students also join me sometimes get confused what to give at what time. And very close to this, I have seen there are a remedy people make mistake, that is China Ars. Now, I hope I have answered all the questions. Anybody, if you want to, I'll give a few seconds before I go to China Ars. Anybody? Or should I start China Ars? Anybody? Yeah, Dr. Vishal says yes, sir. So I should consider, yeah. So I told you something about Eupytorum perfolatum. I told you something about arsenic, and now I'm telling you about China Ars. Now, if you compare China Ars, the first symptom that you should remember of China is fever is continuous. Fever is continuous with weakness. Continuous. Now, I told the anguish, the anticipation, and the thirst for cold water in arsenic. The bony pains that can be on single part also, wrist also, metatarsals, metacarpals, or severe pain in the eyeballs also. In China Ars, the fever is continuous with weakness. That is more important, in China Ars. In China Ars, you can have other symptoms also, but in China Ars, that vertigo when the patient starts looking up, That's again a very, very important symptom of China horse. So these are the very, very minute differences I have seen in case of fever in my practice. So please don't do or mistake of giving one remedy, then it fails in second remedy, then third remedy. These three remedies are very close, and of course the fourth remedy that you should remember is muriatic acid. The weakness is too much. It is written in our books. The patient slides down in bed. It is so much weakness. The patient can hardly walk, can hardly talk. Also, that's muriatic acid. One question on Instagram is horse kidney lobulated left renal pelvis calculus 13 millimeters mild prostate enlargement, please suggest remedy. Horseshoe kidney. Now, horseshoe kidney is basically a disease, a condition where the patient is born with that, left renal pelvic calculus, 13 millimeter. Of course, because of the horseshoe kidney, sometimes the flow of the stone might get obstructed in that. But I had cases where there was stone in that type of kidney and the stone came out. And there's nothing great about the remedies. You must basically understand that it's basically a constitutional problem the patient is born with. So a constitutional prescribing is very important in these remedies. In acute, whatever I've seen in my practice, in acute I've given in these cases Prunus spinosa first. Second, always think about one remedy that is very close, because in this horseshoe kidney you can get recurrent infection. The remedy is turpentine. And the third remedy that you should think about because of recurrent infection in horseshoe kidney is Ua ursi. And of course, the constitutional prescribing is a must because it is itself a problem the patient is born with. So remember that. So this was something about China horse, and immediately one question has been asked, that what about China self? A very, very good question, and a very, very important one also. Let us see something about China self. In China self, remember one thing, that the patient has shivering even in the warm room. That is the classical symptom of China self. And during chill, there is painful swelling of the veins. Patient बोलेंगे मेरे नस नस में दुखता है. All veins are paining. There is painful swelling of the veins during chill. That is a very, very important two symptoms of China self I have seen in my practice. That is shivering even in warm room and painful swelling of the veins during chill. Those two symptoms are very, very important, and the neuralgia commences under the eye and it extends into that and around the eye. Means the neuralgia under the eye, it goes inside or around the eye. That's a very, very important symptom of China self. I hope you understand that. And mostly, not always, mostly I have seen that the China self patients have aggravated on left side. Welcome, Dr. Guruvinder. So these are the 3-4 very, very important symptoms of China self. A very good question in relation to China horse. Very well. So this is how I basically prescribe, and this is how you have to differentiate your materia medica. At least go and read these 3-4 drugs which are so useful in your day-to-day practice. Don't mix the symptoms. Otherwise, you will prescribe one day one, second day one, third day one, and you will not wait. And the main remedy sometimes is missed because of that. I hope you understood that. So let us move on to some other questions. Otherwise, materia medica, we have lots to work. Yes. Next question. Anybody? Anybody? And any other questions? Materia medica is very interesting, and if we start materia medica, maybe every time I tell you something and I'll keep on. You're posted. She likes being alone. Yeah, I understood that question, but okay, if you basically want the remedies for that, the patient is sentimental and she desires to be alone and all, okay. So you can write the remedies if you want this. See, whenever you get a case where the patient says that she desires to be alone and a very sentimental patient, there are lots and lots of remedies. First of all, in this case, think about remedies like antim crude, ignitia, calcarea phos. In fact, you have natramur also, and you have surprisingly sulfur also. A sulfur patient also in psoriatic condition is very sentimental. So these 4 or 5 remedies are very, very important. Antim crude, ignitia, calcarea phos, natramur, sulfur. Of course, there are no prostatitis. Okay, I just missed it. Can you write the question again, Dr. Sangma? I just missed that question. I think I just yeah. You write the question, Dr. Sangma. I'll answer. Meanwhile answer the one question. I have one case of cysts in the kidney. 27 years old lady. Should I go through consult? Yeah. Cyst in the kidney. You have to go to consult prescription. And let me tell you, there are few doctors basically who prescribe LM potencies of calcarea fluor also. I have not prescribed this type of prescription, but they claim that they get good results. So you can try LM potency of calcarea fluor, but whatever I have seen, you have to basically go with consult prescribing. Welcome, Dr. Hital on Instagram. Sir, medicine for permanent cold from 20 years. Whenever the disease has been very chronic and so much permanent, that means I always say, when the body has not been given a similimum, it will keep producing symptoms. So do give similimum to this case so that automatically the permanent cold is taken care of. There are so many remedies, Dr. Parvez. You can start with arsenic or tuberculinum or calcarea carp, calcareas, arsenic, sabadilla, lot of remedies. But constitution, mathematic prescribing is important. Sir, kindly share experience on prostatitis and comparative treatment remedies too. See, whenever you get a case, there is something on Instagram, the same question. So I'll just share something about prostate problems, and there are so many remedies, for prostatitis. There are so many remedies, so I'll just basically tell some remedies which I have found very useful in my practice, day-to-day practice. Now, whenever you are basically treating a case of prostate, you have to first see how is the pain. If the pain basically is in the type of pain, drawing pain, pulling pain, throbbing pain. But the first few remedies which are so many important in case of prostatitis, first is thuja. Very, very important remedy. The second remedy is conium maculatum. Third remedy is bratacarb. Fourth remedy is I told calcarea carb. So these 4 remedies are very, very useful in cases of prostatic problems. Thuja, calcarea carb, bratacarb, conium. Of course, there are so many other remedies, acute remedies like ferrum pick, and very, very important remedy that everybody knows, that is sabal ceruleta. Now you have to see whether the enlargement of prostatitis is in old age. If the patient complains of a prostatic problem at old age or old age problem, elderly men, you have to think about bratacarb, selenium, digitalis, and iodine. Of course, sabalcer, thuja, staphylococcus would be there. Sometimes what happens, the patient has prostatic problem with the history of gonorrhea. In that case, do think about the master remedy medorinum. Second is thuja. Then you have problems of prostate where the patient says the pain in the prostate and there's always accompanying pain in the testes. In this case, make sure that you think about hemamelis, mercury, and berberis vulgaris. Sometimes, the prostate becomes very hard. Even when the doctor does a scopy examination, he says the prostate has become very hard. And whenever you feel that the symptoms of hardness of prostate are there, you have to think about few remedies which are very, very important. Thuja, conium, silicia. So this is how basically you have to interpret cases of prostate and symptomatically differentiate the remedies. Of course, there are local symptoms and the miasmatic generalized symptom, but local symptoms are very, very defining and syphilitic and 3 mark. You can take that for prescription or go for constant prescription. But these are the remedies which are basically very much seen in case of prostate problem. I had a case where the prostate problem was because of high blood pressure, and it gave me a very good results with simple remedies, sabal ceruleta. Sorry, digitalis. Prostate problem with high BP and digitalis gave me very good results. Sometimes you have prostate problem with impotency. That case also think about lycopodium and digitalis. Of course, in prostate problem, it is like everybody has one specific remedy. If you don't understand anything, think about sabal ceruleta. It is like that. Yeah, so Dr. Rakesh Singh, good afternoon. Dr. Mishra ji, good afternoon. So this is something related to prostate. Any other questions? Keep asking so that time is not a time. We don't waste time in between the questions. It should be like very fast. There is one remedy, Dr. Sangma, which comes to my mind in prostate problems. Do think about that remedy also, and that remedy is Copaiva. Copaiva also is a fantastic remedy. If you have read the Mathematics of Copaiva, it's again it's a remedy where the testes are swollen and very sensitive. Copaiva has a fantastic results in case of these complaints, and the patient has constant desire to urinate. Dr. Shweta, welcome. The patient has constant desire to urinate, and that is a very, very important symptom of Copaiva. And sometimes the micturition is very painful. It comes by drops. That is Copaiva. That's what I have seen in case of Copaiva. Yeah, so one more question. Now one question is there, cancer of cheek. Okay, let me be very frank. Cancer of cheek, I had few cases, but they were better. They are better, but I have not cured cancer of cheek, but they are much better. I would like to tell you something. There are still a lot of remedies, but I have got good results in case of cancer of cheeks with remedy, that is a bowel nosode, that is psychotic compound bacillus. Write down, psychotic compound bacillus has given me very good results in case of cancer of cheek. Of course, then there are remedies, lot of remedies. We have arsenic, we have carbamazepine, we have phosphorus. But this psychotic compound bacillus, a bowel nosode, has given me very good results. So last week we forgot to mention about NF type 1 aniscope in homeopathy. I had sent the picture of patient to neurofibroma. Yeah, that case I saw it as a very bad case. The whole body has neurofibroma. And let me tell you, Dr. Sangma, this case would require a miasmatic prescription and repetition with LM potency. The remedies that you should think about in case of neurofibroma in LM potency should be lapis alba, thiocinaminium, calcarea fluor, nux vomica, calcarea carb, and natrum phos. What I have seen in my case. Dr. Vishal, sir, biting under tumbler rubric to be used in whose state of mind? Yeah, see, biting the tumbler, there's a very fantastic remedy for that. That is arsenic album. So whenever the patient is very greedy in drinking and he wants everything very fast, so he sometimes bites the tumbler. It's a constitutional state, and this happens most of the time when the patient is greedy and he does that. In that case, you should use arsenic. यूरिन को कुछ टाइम के लिए रोकना पड़ता है यूरिन करने के टाइम पे और तकलीफ होती है, देन यू मस्ट थिंक अबाउट रेमेडीज लाइक वाउसी, टेरिबिंथ एंड कैंथरिस. Dr. Salam, Walaikum sir, hope you are doing fine. Thank you. I would like to know, if the patient comes with a history of dog bite or animal bite, what should be our prescription? Please throw some light. See, a patient, if he comes to you for the symptom of dog bite or this type, let me be very frank, we normally prescribe Ledampal, we prescribe Hypericum, or we prescribe Belisper. But I also tell, if it is very acute, then the patient has to be told to take that injections. I have cases of dog bite which I treated with Ledampal, and the patient did not take injection, until that he is absolutely better. So prescribe acutely for that conditions. Ledampal is a very important drug. Staphylococcus, Belisper, but I have got very good results with Ledampal. Yeah, that's important. The patient would burn himself. You can be very sure there are 3-4 remedies which I have used in my practice, and sometimes the patient is appearing for some competitive exams and lakhs of students are appearing for the exams and only few thousand seats are there. In that case, I have seen and I have given some remedies. You can write down the remedies. I have used 3-4 remedies very common in my practice. The first is ignitia, the second is hyoscyamus, the third is pulsatilla, and the fourth is thuja. Yeah, so if you any more questions, or it's already half an hour up. Sir, in Allen's given 2 remedies, Bacillus mutilica and Bacillus fes. No, psychotic compound. Now, if you see psychotic compound, you have to read Julian mathematic of Nosod. In that case, you will get a psychotic compound that it is psychotic Patterson, and or if you read Julian, it is written Streptococcus faci facialis. Okay, so this you have to read from not Allen's keynote, from Julian mathematic of Nosod. You will get a very good picture of this remedy. It is either psychosis Patterson or Streptococcus facialis. It is also called it's a Nosod of Patterson. Read in Julian Mathematica Nosod. So that's all. It's already 3:30, 3:35. A very interesting session and very good questions. Thank you for joining me. Until next time, bye.